Hi, my name is Helen, and I'm a mom, a wife, a daughter, a sister, a teacher, and a friend. About 3 years ago, I noticed that I had like a bug bite on my right breast, and I just kind of waited to see what it was because my mammogram was in a couple of weeks. And so I went to the mammogram, results came back, everything was normal, so I just ignored it, that it was just some kind of bug bite or irritation. As the weeks progressed, I thought I was gaining weight, and my right breast seemed to get enlarged, and thought it might be some kind of infection, and went to the doctor. They treated me for a breast infection, and there was no change at all. So they sent me to get a biopsy, or actually a CAT scan, and found out that it was cancer. And after the biopsy, it was confirmed that it was a particular type of cancer that's pretty nasty, not that all cancer is actually nasty, called inflammatory breast cancer. And started my journey. Went through chemo, double mastectomy, radiation, and things seemed to be okay. And I was on a drug called tamoxifen. And about a year later, things started to pop up again. I had a pain in my neck, and it was the cancer resurfacing. So we went through different kinds of treatments again. Trial, it seemed to work. It was wonderful because it had spread to my lungs, and they were filled with fluid and so forth. So it seemed to be okay. And then during that particular treatment, things started to resurface and grow again. And the cancer, what this particular cancer does, is it mutates or it changes, and it becomes resistive to the treatments. Doctors have an idea of what it is, and the different kinds of trials and medications are to stop or to starve the particular cancer cell, and they've identified something that they know inside the cancer cell that causes it to mutate and change. And what they're trying to do is find a way to turn that off. So one of the things that my family and friends were trying to do is raise money for research to find out how to do that. Inflammatory breast cancer, there's a particular doctor, Dr. Overmoyer, who is at Dana-Farber Cancer Institute in Boston, Massachusetts. And I'm lucky to live in Massachusetts that I was able to seek her out. And her particular study in her department focuses on inflammatory breast cancer. So we're going to set up a fundraiser to get money to fund her research there, to continue to help me and thousands of other women who have this particular kind of breast cancer. They're not all the same. And this one is pretty sneaky, because by the time you realize that it's not a bug bite or gaining weight or a breast infection, it's already at stage 3. And it's quite scary. Family and friends, we were able to donate $1,800. And our goal is to get as much funding as we can possible to help them find a way to treat this disease, to find a cure, to turn off that particular protein that's just making it into different things that just become so resistant. And I'm hoping that by sending this video to my friends and family and Facebook friends, and that Ellen DeGeneres maybe can find a way to help get her listeners and viewers to contribute to our fundraiser, that we could pass along that funding to Dr. Overmoyer at Dana-Farber in Boston, Massachusetts. It's scary, but I am not giving up hope. Never lose hope. And together we're going to persevere and we're going to conquer this.